Sarah, does anything need to be done differently if it's on YouTube? No, right?
No, we just need to let people know.
Okay. Will you'll ask that? Do you want me to ask that at the start?
Yes, please.
Okay. Thanks, Sarah.
Okay, it's been done, Richard.
Great. Okay, thank you.
So yes, Richard, I was saying that parallelly we can show our PowerPoint presentation and we can speak. So we were just attending the session and we were also looking the speaker they were speaking and also the presentation was coming.
Yeah, so are you
I
happy
think it is
to,
possible.
are you I mean, I'm ready to share if you like, or you can do as you wish.
Yeah, it is possible because you know, you send us some information that's why I'm telling.
Right, so you will share your own presentation.
You will be sharing. You will be sharing.
I'll be sharing it.
Yeah.
Okay, I'll share yours. Yep, that's fine. So I'm just making people co-hosts. Oops. Okay, and just wanting to mention to those of you who've joined, as well as saying welcome, just to remind you that sessions are recorded and this one is also going to be shared on YouTube.
Yeah, usually it takes some time to people join in the beginning because, you know, I was also struggling a lot in the beginning to join in the group for the new session because there was only very short break for 7-8 minutes.
Yeah. So welcome everyone. We'll just wait a few more seconds while we let people join. We will start and hopefully more people will trickle in. But it's wonderful to be with you all this morning, afternoon, and evening. And my name is Laura Lee. I hope I'm not cutting out. My name is Laura Lee, and I'm the COVID-19 focal point for the Alliance, and joining today as a facilitator for two amazing presenters presenting about an exciting topic. And this is Does a mobile phone save children's lives? And I love that our session is called Innovation. There are one thing that's interesting about a global pandemic is that new innovations come out. And this is something that's certainly an exciting thing to witness. And so in our session today, we will have Nojit and Soz with us. Nojit Karmcharya is a lawyer, and he shifted to development work more than 25 years ago, working with national and international agencies in the area of children's and women's rights. And before joining War Child Iraq's mission this year in 2020, he was contributing to Rohingya Response, a child protection program in the Cox's Bazar for 2 years, with a vast experience prior to that. And Soz Assad is from Iraq, the Kurdistan region, and has extensive experience with internally displaced people and refugees. She's been supervising psychosocial support activities and gender-based violence activities and facilitating. She's been a caseworker with War Child UK, applying her psychosocial support skills, and she's an educational advisor for internally displaced people camps, where she has supervised psychosocial and educational programs and has started some online sessions in 5 camps. So there's another innovation. Maybe that'll come out in the Q&A. So this is an exciting time together. We look forward to walking through. So just so you know, in this session, we won't just be sitting here, we won't just be presenting, we want you to engage. And so you know what to expect. We'll have a presentation from our presenters. Please put any questions or comments in the chat. We'd love you all to turn your videos on when we have discussions. It'd be wonderful to see everybody's faces. We will have a chance for breakout rooms, and we'll discuss and do an activity on Jamboards, and we'll give instructions for that at the time. And then we will also have a time for some to hear from the field, and after that we'll do some closing activities and wrap up. And so that's what today's session will look like. And in terms of ground rules today, we think that we're grateful that everybody's here from different corners of the world, and like I said, turn your video on when we're having discussions. It'll be good to see everybody. And we will just be respectful and help the presenters keep to time as well. Okay, so I think we can move to our presentation. So I'll welcome Nojit. Welcome, we look forward to hearing from you.
Thank you very much, Laura, for your little bit synopsis about our very exciting presentation. So really, we are going to talk about how this innovation is work in Iraq when we started our project. Maybe Richard, can you start showing our presentation? So yes, we are going to talk about this picture is before the pandemic. So you can see the children are very much happy. And at the moment, they don't have this opportunity to come together. And yes, before pandemic, we were very much reluctant to provide our mobiles to the children, but the situation is changed now. So during this pandemic, all the parents, most of the parents, they are providing their mobile phone to children to learn something. And due to considering the mobile phone can save the children's life. So the child protection itself and education itself is the life-saving intervention. Can you flip the presentation, Richard? Yeah. So we know that this pandemic is affected, it is not only like a health outbreak, but is impacted the entire crisis. So it is impacting to the livelihood, GBV, everywhere, and children are most affected by this pandemic. And definitely the children, they don't have the access to the education. The group activities are closed, and you can see the war child group activities were also closed at the time. And there is really need of integrated approach, how we can utilize through using of information and communication technology. So we are going to talk a little bit about that. And we will also talk about how we adopted our program and how we provided our services in child protection and education. And we will be also sharing our experience from the field, what exactly children and their family they said about joining in our online session. And there are some way forward we will be also talking. Richard, can you just flip the, yeah. So particularly, we have several activities we organize through online, and the children they were attending the session through workshop, uh, and uh, we also distributed some home pack for PSA services, and our facilitator they were connecting to the families to provide some feedback, some suggestion how they can organize the session with their own children. And beside this, we were also doing our PSS activities, psychosocial support activities through workshop, and this was really very innovative efforts. And we are also organizing the education session, catch-up classes, remedial classes, we are also doing through the WhatsApp classes. And our caseworker, they were also providing case management services through phone, and they were doing the assessment. They were also supporting children through the action plan and referring the children by using the mobile phone. And uh, there is another activities we also organized through WhatsApp. It was a sports session, so it was very much interesting. Children they were attending the WhatsApp group, and they were involving in the sports session, though they were alone in their house. So they were just together with their some siblings and some friends. So these activities we were also organizing. And the same way we also utilize the social media. Particularly, we were very much focused to utilize the WhatsApp because we found that that is very much convenient and safe and user friendly. And beside this, we also use other social media like Facebook and Messenger to disseminate some information. Uh, yeah, can you flip the, yeah. So this is the manual that we work for the sport activities. So children were enjoying. There are some very simple guideline we provided to the facilitator how they can organize the session. So our case worker they were also providing the remote case management services. Which are next slide. So actually, this is the not the right time to do the evaluation. What is the impact of our online services that we provided through the phone? But we were very much satisfied, and because it is impacting the children's life. But still, we are also planning to organize some impact studies, some assessment, how actually it impact to the children's life. So there are already some discussions and efforts are ongoing to assess the impact, how we did through the online services. So the result will be coming, and we know that there are other agencies. They are also doing some efforts to assess and how the online services and family kid support it is supported to the children. So what side also we are chairing the PSS task force in Iraq. So we are coming together to have one impact assessment and how we can improve our intervention to the children. Next slide, please. So definitely, what we did, it was not easy in the beginning. We also face a lots of challenges. The main challenges about access to information communication technology, because there are lack of internet services, and the children they have not access to the those mobile phone from their parents, and the family is also very much reluctant to provide their devices to their children. Those are some challenges that we face. And when we were distributing our family pack in the beginning, It was also difficult to provide them and because of the lockdown and the curfew. And we also very much conscious about how to safely use the social media like WhatsApp. That's why we prepare a full guideline how that can be utilized in the safe way. So we also do have the WhatsApp guideline the children can attend because sometimes the social media can also create some protection risk. Another slide. So this is going to be my last slide. So with this experience, what we got that there are lots of things to do in coming days. So there is really need a very robust advocacy with the service provider. I mean the internet service provider, how we can establish the access on these devices or internet connectivities that children can have easily or family can have easily access to the connectivities. So in the meantime, we also need to create awareness how to use this technology because this is something new, very much new for most of the context. And for Iraq is also it is when we started, it was sometime we were feeling challenging in the beginning, and we also need to have very closely work to integrate child protection in gender-based violence, health, livelihood, and education. And there is really need robust collaboration with health sector. So this pandemic without health sector, so we cannot work alone. So these efforts we put that, and there is need to do a lots of things to save the children through mobile phone. So we were practicing. We are also proved that it is really life-saving intervention, and we can utilize this ICT in the best way to protect children in the safe manner. So you will be also listening lots of field stories from my colleague very soon. So I think we are going to move towards another discussion, very interesting discussion. So over to you, Laura.
Mhm. Thank you so much, Nojit. And it really is an innovative life-saving intervention and wonderful to hear more details about it. Welcome to the session if you've joined recently. We are talking about, does a mobile phone save children's lives? And we've just heard from Nojit Karamacharya, who has shared with us a bit about that.
It's
So
fine. We
we're
can
gonna
say only Nawajid. It's fine.
so we're going to move into breakout rooms now and do an activity. As we go the whole time, if you have questions, please put them in the chat box or comments, and I'll raise them as they go. Or we will have opportunity for you to ask questions in a bit. So Richard has just included a link to the Jamboard. Please click on this link. With our number here, Richard, I think we can do groups of 4 or 5 because this is a card sort, so they can. So when you get into your Jamboard, so what'll happen is you'll see the rooms on the Jamboard, and once you get into your breakout room, you'll know what room number you are. Click on that room number link, and that'll take you to a Jamboard. So everyone in your room will be working on the same Jamboard. And what you'll do is you'll go to the left-hand side of the screen and click on the box. Actually, for this one, it's a card sort. So you'll see several cards in the middle, and we're asking you to sort them in priority. So we're arranging them looking at the benefits of remote protection services for children. Which are the highest benefits and which are the lowest benefits? So this is a chance to discuss as a group and move those cards around. You just click on the cards and drag. And let us know if you have questions and we can pop into your room. Okay, have fun.
Thank you. So I've opened the room, so please click on that.
We still live on YouTube?
So if I can draw Laura's attention to the fact that room 2's got one person in it at the moment. So would you like me to move room 2? Oh, there we go. Ah, we have 2 in room 2. That's great. Ding.
So Richard, we didn't manage to send Shara in any group.
All right. Hello, Najid. I'm just going to go and see Laura actually into her room and just check when she
You
wants
are
to shut
searching
them.
Laura. Where is she? Actually, it is good to see. Yeah, it is fine. We have only few minutes to. So
Yes,
can we?
I'll
Yeah.
just check with her that she wants to close them. So
Yeah. So Richard, I already left very early from group number 3. So we have 1 minute left. So Laura, I left early from room number 3. I wanted to
Yeah.
see another group there. So
Mhm. Yeah, I left early too.
Laura, would you
Yeah.
like me to close the rooms now?
You can check the time.
How was your group doing, Nojit?
Yeah, they were just starting, and there were 3 people, so they were just starting.
Okay, so do you think
Yeah.
they've had sufficient time?
Yeah, I
Because we have
think.
5 minutes to debrief it if they need a
Yeah,
minute or so.
yeah.
And so, Laura, when it comes to the debriefing, how would you like that done? Because, I mean, do you want me to try and share a screen, or do you just have people talk? I mean, that's normally people have just talked, to be honest.
It would be great to just share one
Yeah.
Okay.
screen, and then we can have people talk.
Yeah.
Does that sound good?
One of the
Yeah, it is
Jamboards,
good.
so just have one.
Yeah, maybe we
Yeah.
can also ask to group
Just-
that they can just speak, because we also need to engage them, so they can also speak if they like.
Yeah,
Right.
it won't be yeah.
Yeah,
That'd
we
be
can
great.
manage it in 5 minutes. Yeah.
Great. So yes, bring them
Okay.
back. And
Bring
we
them
can
back.
share
Right.
one.
I'll close all rooms.
Thank you,
Yeah.
Richard. Okay, welcome back. I think we have half of you. Others are finishing up and will join us. Those of you who just joined back, did you manage to finish sorting?
We took a creative approach, but we did.
Excellent. We like creativity. Which room were you in?
Number 4 with Anne Laura together.
Okay. Richard, you could share. Could share room 4. Apparently, it's creative.
We can start from room 4, then 3, then 2.
We'll just share one of
Yeah.
them.
Yeah.
Okay. I'm about to share my screen. Just hold on. In fact, let's just share this one, I think.
Great. Would one member from group 4 like to comment on their card sort?
Yeah, sure, I can do that. If you're all right with that, Anne Laura?
Yeah. So I can, just add a few things if needed. Put that there.
Perfect. Let me see if I can turn on my video as well. Yeah, that's working. So hello everyone, I'm Petra. I'm actually a colleague of Navajit's, and I'm the education coordinator. And I've been working with Anne Laura, who is working for Plan International, but also has connections to the Alliance, if I got that right. And we have been discussing a little bit on that. This is quite hard to bring into high and low priorities. So we kind of deleted those and tried to interlink them together, having the target of protecting children from risks at the center of it. And then, of course, having children engaged and building their resilience is key to the whole process. And that enables us to engage them in education, but also to provide them with additional knowledge around COVID-19. So we found it really hard to have priorities because they're so interlinked. And for us, there are also kind of different categories of those. So we rearranged it a little bit and we're a little bit creative about that. And Laura, do you want to add anything?
Well, yeah, but I think you mentioned everything. So just to well, we were hesitating to keep the instructions, but then we removed them because we just thought that everything was a bit interlinked, and there were like some kind of outcomes and other type of different categories. So much more outcomes and others much more kind of interventions, or So this is why we went for a kind of drawing
Okay.
that was supposed to be a kind of circle showing those interactions.
Okay, thank you. Thank you very much. And Nojit, did you have a response to that? It just certainly generates an interesting discussion thinking about the different benefits
Yeah,
for
maybe
children.
we yeah, thanks Laura. Maybe we can also listen if any group want to share what they think about this. Or
Maybe one more person cognizant of time.
yeah, maybe
Only
if someone wants, they can share from any group.
I can speak from group 2.
Yeah.
Hi, Najib. Hi, it's Georgia. I also work for War Child. But in our group 2, we kind of, similarly to Petra, we kind of thought that all of them were a priority, but we put the gaining knowledge on COVID-19 as the lesser priority, although still a priority, because we thought that children would probably access knowledge on COVID-19 through other mechanisms. So if we were talking specifically about using this WhatsApp platform, then our priority wouldn't necessarily be for them to gain knowledge on COVID-19 in the hope that they would be getting it through other sources, especially if they were in, education. Yeah, that's why we put that last.
thanks, Georgia. That was my group. We did a good job. And Nojit, did you have a response to that or any
Yeah,
comments on the activity before Soz starts her
yeah,
presentation?
actually, thank you very much for all of you for bringing your group work and providing the suggestion. Actually, yes, we are very much agreed that it needs to be linked together. So there is no like one priority is very much high if children are engaged or children they are building it is linked together. So whenever we talk with the children, whenever we follow up how they like the session, and we also talk with the families member. So what are your key priorities? So there are different kinds of suggestion and feedback we are receiving from the family. So it doesn't mean that if we contact with the 100 families, the same they do not say like this is our priority. So there is whereas there is different from place to place, from camp to camp, because we are working in mainly 3 bases. War Child, we have Mosul, we have Baghdad, and also Dohuk. So from all the places we are receiving the different kinds of feedback. So that is really very difficult at the moment to just stick in one priority. This is the high priority, because it depends on their participation, what exactly family they feel about this intervention. So it is more about their feeling that we reflected here as a question, because we were receiving their feedback through our follow-up services. So whenever we talk, what do you like? So these things they were talking from the different way. But yeah, you are right, and you did really very good group work, and definitely the group work. I mean, the education, PSA services, they are closed at the moment. So all the priorities are very much important. So I just lost my electricity, but but yeah, yeah. Fortunately, I have internet, so it will come within 1 minute. So this is we are going to say just explore what exactly the child, the families, they are saying from the field. So Soz is going to represent from the field. So she is going to tell more live stories, what exactly the children says. So over to you, Laura. And I hope that people are
Great.
writing any question if they have in chat box. Over to
Okay.
you.
Welcome, Soz. Thank you.
Thank you, Laura. Hi all. Only I want Richard put the record of the child.
Start the recording, Richard.
Yes.
Thank you.
the sound is very low. I
It's
cannot
very
hear.
low.
Guys,
Sorry, Richard. The sound is very low. We cannot hear the sound.
He's trying to adjust it. So
Right. Right, my apologies. I'm going to do that again, actually. We'll do it Mark 2. So let me just do
yeah,
this here.
we can.
There we go. So let us try this. And I hope it won't be too loud for everybody. So please do let me know what it's like. So let me just move back to here.
هرديم وارشل مساعدة ما بقاش بالمدرسة هرديسا كورونا هاي مدرسة بنا ببد في أنديسا خورد بنظم ببنا أول تسفي وقد تعدل ما نبي وديما متخورد بنو وهوالد ماجيك تخورد بن درجة خوزان بنو وكا كورونا قالك تعدل مكرومات زي أم هردم درجة خوزان بنو مش بيرنا كنوار تشيلجي دورة أونلايش مرة فكر ودرجة إنجليزي في المكر والرياضيات وعربي هم كافي المكر وارتشلجي وكم ساعدة مكرش بالمدرسة.
Okay. There are comments from the one of our beneficiaries, children attending our online session. He said, we are asking from our child to helping us because COVID-19 pandemic existed and remained spread. And we want from our child opening the or more online session to success at the schools and get the very high degree at the schools, because the war child helping us during online session, last session, they are opening for us Arabic session and online session related to the schools. Also, a teacher of the schools helping us, but during the lockdown, online session, they are very helping us for the exam and teaching us online. Yes, they are one of the child have a comment, but we have another comment I want to sharing with you. The comment of the child, one of them said, during the lockdown, there was nothing to do, and there were no school, no PSS activity, no any group activity. The only thing that I was eagerly waiting was the session, since I was benefiting from the session that have been given to me during COVID-19 lockdown. It improved my learning and enhanced my education state, since there was no other activity in the camp. I'm so glad to participate in the station through the WhatsApp. My father and mother gave me mobile to attend the station in WhatsApp, because I'm engaging in the learning, which reduced the risk of being stressed. And we want to listen how the children feelings. At 16 years old, Rawan said, I like the WhatsApp session more than verbal teaching session, because it helped us to practice social distance and protect us from COVID-19 pandemic. Since during the lockdown, I always want to be protective, time consuming and learning with my friends. But I was afraid to get affected by the virus from one of my colleagues. This type of online activity led us to learn and being protective and engage with other facilitators, which I feel best time of the day. I feel safe and not protected with the virus. Protected with the virus. Alan said, I have shown an improvement in my interpersonal and enjoyed to talk with my friend. And the online group learning has given me a chance to continue connecting with my friend during the extended lockdown in the camp, which helped me to change mood and had a positive impact on my daily life. if there would not be any such activity, really stress. And we won't listen one of the comment of the caregivers. He said, at this period, I was very worried about the future of my life, of my children, and how to protect them and teaching them at the same time. And during the period of the spreading the disease, they engage with other people. But when they registered in this online PSS program, I was very happy to see my children is engaging the PSS online session in the house. And I am satisfied that they will stay at home and not exposed to the virus. And in the same time, they are also learning how to protect themselves from being abused and be the safe environment. Yes, there are some of comments from the beneficiary, child, and their caregivers. And thank you, Laura.
Thank you so
Thank you,
much.
Rachel.
It's really powerful to hear the voices of the children and those other people affected in your communities, and to see their faces through those videos. Thank you for preparing that. And also to see the impacts that the projects are having. Okay, we have a question to answer in the Mentimeter, the second one, Richard. So please go there, click on the link. Any final comments, please put them in the chat. Nicola says it's wonderful to hear the voices of the children. Thank you. So minimize that screen and pop in your word. So the words are coming through. Nojit, feel free to say your final words as the words are coming up on the screen. And so is if you have any final thoughts as well.
Yeah, thanks. Thanks to all participants who are putting their own words. It is really very nice to see. I can see there are some words related to the mobiles also, and it is also very much encouraging that you participate in this session. And really, we are very much confident that the intervention, education, and protection is life-saving, and that is contributing through the mobile phone. So we are still trying to continue this effort, and we will have definitely very close collaboration with the other child protection partners, and we will keep our efforts on that. Thank you very much for attending this session and for your view.
Thank you so much. And thinking about those words going up on the screen, the power of engagement, of innovation, collaboration, and creativity. It's just wonderful to see this, and innovation like this able to reach even the most marginalized. So we thank you so much for the work that you're doing on the ground. Please greet all your colleagues for us, and we leave here encouraged today and inspired in our own work. And thank you to all those who attended as well. We really appreciate your time and your participation, particularly in the group work. And we look forward to seeing you again later this week.
Yes, thank you very much, everyone, for joining us. And just a note from the organisers, we are taking a quick break and start again at 22. So please click to leave this Zoom room. In Kiko chat, find the session you're interested in joining, click to join that session's room, and then click the green Zoom link button to join the meeting in Zoom. So if we can encourage you to do that now, so you're ready, even if you're going to take a quick nip away from the computer, have a quick break, but nevertheless, if you can join that next Zoom, that would be brilliant. Okay, thank you, everybody.
Richard. Thank you, Laura, for your support. Okay, bye. Okay, bye.